السلام عليكم. طيب يعطيكم الف عافيه يا رب. اول شيء يعطيك العافيه دكتوره سماح for this nice presentation. Actually, يعني I've been in many debates about ketogenic diet. I've dedicated my life since 2018 in reading and criticizing most of the ketogenic nutrition data. So not all the data about the ketogenic diet or that labels nutritional ketosis is valid. That's why our aim is to change our perception and our knowledge about ketogenic nutrition, because it's not just a diet. My objective today is only give you a snapshot on the history of high-fat, low-carb diet. Then I'm gonna emphasize on the concept of well-formulated ketogenic diet versus popular keto, okay? And then I'm gonna present some latest evidence or review of evidence. So did you know that high-fat, low-carb diet, currently known as ketogenic nutrition, has been in medical practice and literature since 1860s? I would like to start with this quotation from Sir William Osler. He's considered the father of medicine because he was the one who invented or created the residency program, and he's one of the 4 founders of Johns Hopkins medicine. Sir William Osler, he wrote, he published a book about the principle and practice of medicine in 1892. This is the first edition. And he wrote down 2 chapters about diabetes and obesity. And he said in diabetes, it's a disorder of nutrition, and prevention is through lifestyle modification. So when I read this book, okay, I saw a lot of intervention. It depends on lifestyle first, then medication later on. So he said that prevention, if a patient has a predisposition to diabetes, so back then there's no type 1 and type 2 diabetes, only diabetes. So prevention is through restriction of carb. And the dietary treatment for diabetes back then, before the invention of insulin and modern medication, is very low carb, low to moderate protein and high fat. And he said, and I can go back, that the person who take the medicine must recover twice, once from the disease and again once from the medication or the medicine. So this is what he considered the father of modern medicine. What we are practicing now is the opposite of his saying and his way of view. And we are going back to lifestyle medicine, and we are treating the patient once from the disease and again from the medicine. Also, in his book, he wrote down all the allowed and not allowed in his diet, and it's resemble, again, the modern ketogenic diet or the well-formulated ketogenic diet. And according to him, all cases are benefited and some are cured. So the concept of diabetes reversal or diabetes cure has been in literature since 1892. It has been absent until, I think, lately in late 1980s. So it has been gone from the medical literature about the concept of cure. So it was there. And he said, all are benefited and some are cured. Again, until he published a lot of multiple editions, and the last one was 1919. So before they began to use ketogenic diet for epilepsy. And again, if you see the food group here, carbohydrate is 10 grams, protein is 75, and fat is 150. So it has been there. And anyone knows what happens in 1919 or 1920 or 1921 is the invention of insulin. So insulin was a breakthrough. That's why the popularity or the usage of ketogenic diet or high-fat, low-carb diet has been gone from the medical literature. Again, we can see before that, Dr. Pavy in 1869, he wrote in the Research in Nature and Treatment of Diabetes. And the menu here is resemble the modern-day well-formulated ketogenic diet. And again, Dr. Epstein, known for Epstein anomaly, in the corpulence. So corpulence is obesity. So in the treatment of obesity in 1890, and he wrote down that we should exclude or should limit carb intake, and we should emphasize on eating more protein and fat. So we will not depend on these nowadays. We have to know what are the latest evidence. So again, in 1921, the same year that the epilepsy has shown to be benefited for the ketogenic diet or for the high-fat, low-carb diet. Here in the JAMA in 1921, Dr. Wadiat, Dr. Wadiat, he's the one who contributed the most to the era of ketogenesis and anti-ketogenesis. And he's the one who discovered the beta-hydroxybutyrate measurement in the blood. And we see here in the appendix, he wrote down high-fat, low-protein, low-carbohydrate diet as a modality to treat diabetes. Again, here in Mayo Clinic in 1922, Dr. Wilder, he's the one who coined the name ketogenic to this dietary approach. He was using this approach, a low-carb approach, according to carb tolerance. So he divided into less than 30, less than 50, and less than 100. And it has been used in treating diabetic patients before insulin era. So again, when we hear high-fat diet, okay, or when we research on the literature about high-fat diet and the danger of high-fat diet, this is what they mean by high-fat diet. And this is also a high-fat diet. So anyone is convinced that this diet can cause heart disease, when we incorporate meat, greens, and avocado, as well as eggs, and anyone can convince me this is dangerous. This is as well a ketogenic meal. And again, the one on the right is also a ketogenic meal. That's why we should emphasize on how to do a well-formulated ketogenic diet rather than doing keto as a whole, or just increase your fat, just increase your protein, just eat animal fat or animal protein. We should be more specific in dealing with a ketogenic diet. The father of modern-day ketogenic nutrition is Professor Stephen Phinney and Professor Jeff Volek. They established the Verta clinics in order to supply us with many data about the ketogenic diet, and they are the one who invented the well-formulated ketogenic diet that we are using today. So they wrote down 10 characteristics of the well-formulated ketogenic diet. So first of all, it must result in sustained nutritional ketosis. So the carb is not eliminated. The carb is here. We have carb, we still need carb, and we still eat carb in a ketogenic diet. But it has to also sustain the serum beta-hydroxybutyrate or ketone level between 0.5 up to 4. So there's difference between nutritional ketosis, there's difference between starvation ketosis, and there's difference between also diabetic ketoacidosis. So nutritional ketosis is in the beginning of this spectrum. And diabetic ketoacidosis is at the end, when the beta-hydroxybutyrate is more than 7 or 8, and type 1 diabetes in certain population. Also, it should preserve lean body mass. So anyone who is not eating enough protein to preserve his lean body mass because he want to lose weight fast, that is not well-formulated ketogenic diet. And we are against losing weight fast when losing lean body mass. It also has to contain enough electrolytes and minerals, and it's really easy to make the ketogenic diet a more complete in all micros and macronutrient. Like for example, if when sodium intake is increased a little bit in ketogenic diet compared to other diet, magnesium, we should emphasize on eating magnesium. Most of the patients who started on ketogenic diet, usually they are trying very low calorie diet before they start ketogenic diet, and they are in a state of nutrition deficiency before they start ketogenic diet. That's why we emphasize on giving the patient a period with no dieting at all, just to flourish the body with all the nutrients, then we can start the ketogenic diet. Also, the majority of energy intake from dietary fat, and counting and restricting calories is not necessarily needed. But that does not mean that we should indulge in fat and we should add fat to our diet. we should be more conscious and more aware of what we are putting in our plate. Also, it should be mostly whole and processed foods. So when we are dependent on the processed food, or we are eliminating the fresh vegetables, fresh fruits like the berries, strawberry, blueberry, and the rest of berry family, eggs, meats, nuts, and seeds. So when we are, like Dr. Samah said, there's a selenium deficiency, we can give the patient Brazilian nut. One Brazilian nut can cover most of the patient needs in the ketogenic diet to cover for potential selenium deficiency if they are restricting their menu or their allowed items. It also should not be under 1,000 calories. So a lot of patients will restrict their calories very much to the stage that they are considering now in starvation ketosis. We are not encouraging this. We are encouraging to eat enough calories. Okay, so we should encourage more complete menu rather than sticking to under 1,000 calories, because it will increase or decrease our appetite and will increase our capacity to pass time without food or without thinking of food. Also, it should have a maintenance phase for chronic condition. So when we start ketogenic diet with restrictive menu or restrictive items, we should, with the follow-up, we should increase this menu according to the patient preference and needs. We should not be sticking to one item or one menu or one table, and then we say, okay, with the patient ketogenic diet for a long period of time, there's a lot of nutrient deficiency, there is strict calorie restriction, and there's no much variety of food that is included in our menu. Then we should not blame the patient for not being able to achieve his goals. We should blame ourselves for not knowing how to increase the variety of food with time.
4 minutes, doctor.
Okay, so it should be also require expert supervision if intended to treat or manage chronic diseases, and does not necessarily adhere to the traditional guidelines. Okay, so if you see this graph, all of these, none of them is under 1,000 calories, so it's not very low calorie diet. These are the ketogenic diet, okay? So there's a lot of variety to do a ketogenic diet. So we can eat seafood ketogenic diet. It can be poultry, it should not be all animal-based. It couldn't be animal-based, could be vegetarian, and it could be also plant-based. Now we see on the right plant-based ketogenic diet. So it's a diet that induces ketosis without making the animal protein as a primary source of protein. Also, we have in Saudi Arabia, في السعودية, عندنا البدائل كاملة. So we have the bread, we have the sweets, and also we have the pastries. So it's really palatable. Even here in حائل, ما شاء الله وصلتني قبل يومين, also meal preparation, or healthy meal, it's considered key to sweets and everything. And I can find it in most of the cities of Saudi Arabia. So they have the bread and they have all the substitute available. So it's really easy to comply here in Saudi Arabia nowadays. Is there evidence? So if we look at the standard of medical care in diabetes in 2021, and then in 2023 in chapter 3 and 4 and 5 in the prevention and in the lifestyle management, we can see that there's, in their summary, they said there is no ideal micronutrient. It should be individualized. And a variety of eating patterns may be appropriate for patients with pre-diabetes, including the Mediterranean and the low-carb diet. So it's there, and there is no single approach that's proven superior to other dietary approach. And they also publish a manual for dealing or committing or starting low-carb and very low-carb diet. That is a guide for healthcare provider, and I think it's $9 or $8 or $9. So they even put guidelines on how to implement low-carb and very low-carb diet. And we have reached meta-analysis as well, so in diabetes. So they said in conclusion, ketogenic diet may be advantageous in type 2 diabetes, in type 1 beneficial, but our data are limited, and it could improve the quality of life of many millions. That's why it should be individualized according to the patient preference. And according to the manual, if the patient does not, or his blood glucose not maintained with the medication, or the patient desire is to stop all the medication, then the only solution is a low carb and very low carb diet. Also, we have a review in cancer as well. So this review said that ketogenic diet is not a substitute for anti-cancer treatment. We should treat the cancer, and if we implement the well-formulated ketogenic diet, then it can enhance the efficacy of classical tumor type, but it's type dependent, and the application is well tolerated, and it increases the quality of life. They said in the literature that the patient feel more control of their life after the adopting ketogenic diet. But we have to know to have more standardized and guidelines on how to implement it in this patient population. Also, for pain and inflammation, I will present now the latest papers, okay? So there's a lot of papers, a lot, and maybe every day I can see a paper published regarding ketogenic diet or beta-hydroxybutyric or ketone level. So it's really hard to keep up to date with all the data regarding ketogenic diet. So here we can see the well-formatted ketogenic diet. So the well-formatted ketogenic diet has been now in the literature. And this, they look at only pain, but they said they saw improvement in weight, depression, anxiety, and also systematic inflammation. Also with the mental health, now in the diagnosis and treatment of some of the most common mental illness. So it has an effect on mood, and it has an effect, an anxiolytic effect. It can give you more control of your life. So they are considering adding the measurement of beta-hydroxybutyric to assess for mental illness as well. Okay, and this can be done by either ketogenic diet, or we have a mimic of ketogenic diet, like using MCT or medium-chain triglyceride. There is also exogenous ketones, ketone salt, ketone esters, that has been proven now or shown in the literature that it can also benefit the failing heart. So when we have a patient with a heart failure, and we give him back his ketones because we're depriving the body from ketones, and we're giving him as a supplement or add-on medication, then it can improve heart failure. Okay, and so also it can regulate appetite as well. So either using GLP-1 agonist, okay, or either use ketogenic diet, it all leads to appetite suppression. So if we don't want to start any of the GLP-1 agonists, then ketogenic diet has proven that it will blunt our appetite, and its direct effect of ketone body. So sometimes we are giving MCT or medium-chain triglyceride to elevate the blood ketones in order to suppress the appetite even further. But that does not mean food is not necessary. We should emphasize on lifestyle changes in our relationship with food, not to avoid food. We have to schedule our food, but it will improve our appetite as well. Also, now they are studying ketogenic diet to slow aging and improve longevity through different mechanism that will lead up to longevity. Keto can
Time out, Doctor.
and should be, yeah, this is the last slide. Keto should be gluten-free, 100% sugar-free. It should be plant-based. We should emphasize on the vegetables and the fruits allowed. Should be palm and vegetable seeds oil-free. We should lead to decrease or control blood glucose, less insulin usage if we are using insulin, and less inflammation and more brain power. So well-formulated ketogenic diet or well-formulated ketogenic nutrition is an evidence-based lifestyle approach. So it's not a temporary approach, it's a lifestyle approach. We should do it properly. Thank you very much. Maybe I'm biased, okay, by the way, I was reluctant to publish my book about the ketogenic or guidance to ketogenic nutrition, but due to lack of proper guidance for the ketogenic. أنا عندي كتاب التغذية الكيتونية موجود في مكتب الجرير. الحمد لله مع أول شهر وثاني شهر تفاجأت إنه بينطلب الكتاب من تقريبا أكثر من 10 مناطق في المملكة، من قرى موجودة عندهم، ولما تواصلت معاهم لقيت إنه تطبيق التغذية الكيتونية وتطبيق نظام الكيتو سهل جدا عندهم. وبالعكس كانوا في البداية يعني أنا الحمد لله لي في تويتر وبعمل توعية لكيف إنه الشخص يكون عنده الكيتوجينيك دايت از لايف ستايل، وبيشوف إنه كيف بالعكس إنه حتى العزايم وحتى حضورهم في المدرسة والجامعات وغيرها بالعكس بيطبقوا الكيتو، واللي حولهم كلهم بيقولوا طالما شايفين فائدة وطالما شايفين انكم مبسوطين ومستمتعين وبتحققوا فوائد كثيرة علمونا. فللأسف الشديد انه الأطباء خلينا نقول او المختصين الصحيين في هذه المناطق ما بيقدموا هذه الخدمة، فصارت الخدمة مجتمعية، فصار كثير منهم يجون يقولوا اوكي طب اعطينا، احنا ما نبغى نقدم لهم معلومات خاطئة، طب اعطينا معلومات عشان لو جلسنا معاهم نقدر نعطيهم المعلومات الكافية. That's why I published my book. You can access my social media. Thank you very much for having me. Thank you very much. I thank the scientific committee, the organization committee. It really was a wonderful experience. I hope you enjoyed this lecture. Thank you very much.